Hello, we are Group 14. In this podcast, Hypertension and You, we will be talking to you about the effects of hypertension, commonly known as high blood pressure. Problems with hypertension can damage the most important organ in the human body, the heart. Just by not keeping this condition under control, it can lead to major damage to the world symbol of love. Hypertension can be a deadly disorder that happens when the pressure of the blood running through your body becomes too high. This is usually caused by plaque, which is fatty material that forms in the arteries over time. The higher your blood pressure becomes, the more damage it does to your body, especially your heart. The human heart pumps blood through the entire body. Hypertension can damage this organ in a number of ways. You may wonder, in which ways does hypertension affect the heart? According to the National Heart, Blood, and Lung Institute, hypertension forces your heart to work harder than normal to pump blood to the rest of your body. This causes the left side of the heart to thicken or stiffen. This condition increases your risk of heart attack, sudden cardiac death, or heart failure. Heart failure, also called congestive heart failure, is a condition in which the heart can no longer pump enough blood to the rest of the body. This is the most severe effect that hypertension can have on the heart. Over time, the stress on your heart caused by hypertension can cause your heart muscle to weaken and work not as well. Damage from heart attacks adds to this problem. The American Heart Association gives information about warning signs of a heart attack. Here, we have an example patient. Looking at her family history, we need to make her aware of the symptoms since they are very important. Unlike we see in the movies, most heart attacks start slow, and patients wait too long before getting help. Symptoms to look for are chest pain and loss of feeling in your left arm. Women are more likely to have shortness of breath, upset stomach, vomiting, and back or jaw pain. There is also information related to warning signs of a stroke. The patient's blood pressure is currently controlled, but it is always important for patients to have a healthy diet and add exercise into their daily routine. Suggest that this patient print out the 5 fruits and veggie document. This is an easy way to track the servings of fruit and the amount of physical activity the patient is getting. They should try to get 5 servings of a day of fruit and vegetables, where a serving is about a handful, and at least 30 minutes of physical activity 5 days a week. The patient can download the document here. If interested in watching other podcasts about high blood pressure, A Cup of Health with CDC, Heart Health, and A Cup of Health with the CDC, Living a Less Salty Life are 2 other great options. In closing of this podcast, we would like to leave you with a healthy tip and a reminder. By lowering your salt, red meats, sweets, and increasing healthy foods in your diet, you can fight hypertension and heart disease. Diet changes can lower your blood pressure and help heart health. Just remember to keep a healthy diet, be careful of your alcohol and tobacco use, exercise regularly, and hypertension may be the least of your worries. Also, think about that once hypertension affects your body, it may be hard to get rid of the damage. We would like to thank you for listening to our podcast, and we hope you learned information from it.